So do 19, it's in the back of the head. And what we're doing is you can feel back there and sometimes feel on your own scalp. You'll feel sometimes some squishiness back there, maybe a little bit of a tenderness. And as you go down from the top of do 19, go down towards do 16, this whole area represents the spine, where the uppermost area, do 19, is the tailbone. As you go down, you start to get the lumbar, thoracic, cervical. And you can feel through there. I will needle this area, same way as I did with the scalp points, what I showed in the front, same kind of idea. 1.5 to needle, Chinese or Korean style needle, put it in and thread it through that whole area. Once I've threaded it in the skin, then I'll hold the handle very tightly, and then right over the skin itself where the needle is inserted, over that, rub somewhat vigorously back here and do 19 actually. And what I do is what Dr. Wong taught me is the person sits upright. They sit upright, you put the needle in, and then you tell them, okay, now I want you to do some slow, smooth, deep, even breathing, gentle breathing, and imagine where the pain is. Let's say it's in the tailbone, let's say it's in the thoracic. For this person, I'd say, imagine your mid-back. Imagine your mid-back, do some deep breaths, breathe in. Another breath. One more breath. Hold it. Now cough. And then I stop stimulating. A very effective point combination. A point technique. You might put a few points in there. If somebody has some lumbar and thoracic, you might put 2 points in there. I just want to show the stimulation of that over the needle. Now, I don't do the whole thing with the breath and cough. I just want to show the idea of how I'm holding the needle very firmly and then stimulating over the skin. And you can see that there. Holding very firmly and then stimulating with the index finger. Now, this is the person who came in with the feeling, low back pain, low energy, feeling a little bit just, feel blah kind of thing. You can see it on his face, obviously. Now we look here at the nose, at that lumbar area. So I'm trying to help open up that circulation there. And you can see afterwards how it not only filled in that gap, but it literally lifted him up. Dr. Wong has a pretty amazing story of he was out in the countryside driving on these country roads, and there was, going down this mountain, and there was a lot of construction work, and someone had lost control of their car and had crashed and literally was thrown from their car into a sandbank head first. When they were thrown into that sandbank, their spinal column just collapsed like an accordion, like that. And Dr. Wong, saw the car, he saw the person in the road, got out of his car, what's going on? The guy totally shrunken down, like literally, Dr. Wong, this is real. Like Dr. Wong did not make this up. Shrunken down, like probably maybe, 6 inches, a big down. Maybe it wasn't 6 inches, 4 inches, but shrunken. Dr. Wong, okay, I got the idea. As always, he carries needles with him, went to his glove box, got out the needles, had the guy sit on the roadside and do this very technique. Put in do 19, stimulate it with that breathing technique, and then breathe, and then hold, cough. When he coughed, he literally, Dr. Wong said he literally just like uncompressed, and everything just like came back up. Now, it's a very extreme case. This person did not come in completely hunched over for this, but you can see energetically how it did lift their spirits. It did lift their energy. It did lift their Shen. And this is the idea how we can use facial diagnosis to judge how our treatments are working. Did it work? Okay, yes, the person said his back pain's better, but can we see those changes on the face?